Hello and welcome to Chesapeake Weekly Home Edition. We've got a lot to get to this week, so let's jump right in. Time is running out for both businesses and citizens to apply for grants from local CARES Act funding. Monday, November 16th is the very last day for businesses and residents to apply for a grant from local CARES Act funding. Residents who have faced employment hardship due to COVID-19 and who are struggling to pay their rent, mortgage, or utilities can apply for the assistance. Call the Housing Crisis Hotline at 757-587-4202 to apply for those grants. The November 16th deadline also applies to the grants for small businesses. These grants are available to for-profit businesses that have been adversely affected by COVID-19. To see if your business is eligible and to apply, visit chesapeakeva.biz/recovery-grant. And around this time of year, we start talking about flu season. And this year is absolutely no different. We want to make sure that just because we're dealing with COVID, everybody remembers that flu season is still a concern. So if you haven't gotten your flu shot, now is the time to get it. Everyone should be getting their flu shot this year. Now, thankfully, with the flu, we have that vaccine, which helps, it does make a helpful difference between flu and COVID. And there's also a medication that if you do get the flu, you can take that will help lessen the effects. So there are differences, absolutely, between flu and COVID. But while we're dealing with both of them together, we need to make sure we're giving each of them the attention that they really need. Believe it or not, all of the masking and social distancing, physical distancing efforts that we're making for COVID, experts believe that that will help with flu. Flu is also a respiratory spread disease. So by wearing those masks and maintaining physical distancing, we're all better at washing our hands. And of course, the big one, staying home if you're sick. That one's huge. We hope that that will help us through flu season. There's still a lot to be aware of when it comes to the flu, so I went over to the health department and got to have a really great conversation with Health Department Director Dr. Nancy Welsh and the Chesapeake epidemiologist Lisa Engel. We're going to pull a couple of bites from that for you. Now, my first question to Dr. Welsh was, how will I know if it's flu or if it's COVID?
It's going to be confusing for folks because the symptoms are very similar. Both of them are respiratory diseases. They get fever, they get malaise, they get respiratory congestion, coughing, trouble breathing. So they have very, very similar symptoms. COVID is unique in that they do have some unique symptoms. Okay. They have an altered smell often, or an altered taste, and that definitely is a clue that that is COVID, not flu. But they do have similar symptoms, and that actually, because physicians don't want people necessarily coming in and contaminating other patients, they may do a lot of advice over the phone.
Sure.
So that they also are protecting the other patients who are at the office. And so sometimes the symptoms being very similar can be confusing.
And then, as I mentioned, I got to speak with epidemiologist Lisa Engel, and she helped me understand more of both the similarities and the differences between flu and COVID. And she was really insistent on the importance of continuing those mitigation efforts, the masking, the physical distancing, because of how helpful it is, not only for COVID, but also for flu.
Flu and COVID are very similar in the fact that they are respiratory spread. Okay. So the mask and the social distancing that we're using is talking about droplet spread. That's why we're saying droplets don't spread farther than 6 feet. If you can't maintain the 6-foot distance, then you wear a mask to protect other people. What we're trying to do is keep the respiratory out from you, away from other people. You're wearing the mask to protect other people, not the other way around. Okay. You do have a little bit of protection. That's obvious. I mean, your nose and mouth are covered, but the cloth masks really are used to keep the respiratory droplets out of the environment. So that works for flu as well as it does with COVID. Somebody has asked before why didn't we do this with flu season? Yeah. I would have loved to do it with flu season. The number one takeaway with the flu season that I hope carries over because of COVID in the future is for people to stay home when they're sick. That's the biggest thing that we're talking about with COVID. Everybody's heard this isolation term, and that means staying home when you're sick. If we got everybody to do that, we would not have as much of any of this in the environment as we do.
You can see that interview in its entirety on our YouTube page, youtube.com/Chesapeake Television. It's very informative, and I do hope that you'll take the time to watch it. While you're there, we also have another interview that you might find interesting on a related topic. Chesapeake Television's Jim Hazel spoke with a board-certified pulmonary critical care and internal medicine doctor from Chesapeake Regional Healthcare about coughs and how, what are the different types of coughs? How do we know when it's more than a cough? Lots of really great information in this interview, so here's a little piece of that right now.
So cough is a physiological response. So we all cough for many conditions, and if I break it down into acute and chronic cough, I think that might help people to understand. So acute cough is cough which lasts for less than 8 weeks, while chronic cough is something which goes on for more than 8 weeks. The common causes of acute cough are respiratory tract infection, like pneumonia, bronchitis, flu, and COVID-19.
All right.
And the chronic causes are postnasal drip, reflux, or asthma. Sometimes some medication can also cause cough, and chronic lung conditions like COPD, pulmonary fibrosis. There is no real difference between COVID-19 cough or regular cough.
Oh, okay.
So COVID-19 does not come with, oh, this is me causing cough.
Right.
But
so you
if
can't
somebody,
tell.
right, you can't tell. But if you have fever, if you have shortness of breath, and if you think that your oxygen is low, that's when you need to think about getting tested for COVID-19. Also, any people who are at high risk for complications, like somebody who has immunocompromised state, like they're on dialysis or elderly, and if they have cough, I think I don't wait for 3 weeks, and those patients should be checked sooner.
Right.
Same thing with the healthcare workers or those people who work in grocery stores or places where they are around too many people. 3 weeks is a long time for them. So if they have cough and they don't have an explanation, like they don't get allergies and suddenly they are having new cough, maybe they should be checked.
And again, both of those episodes of Peak Life, the interviews in their entirety, are available at youtube.com/Chesapeake Television. Let's shift gears a little bit now to talk about some great programming we have here in our city for the 55+ community. If you haven't checked out the workshops and webinars and fun activities that we are holding, even in virtual settings, for the 55+ community, you're really missing out. So we went by and got to talk to Parks, Rec, and Tourism's Karen Christie, who really is the knower of all fun for everyone, but most especially 55+. Look, she's just, you can't get enough of her. Take a look.
Here at Rokeby Center, we are conducting curbside activities. It's the day before Halloween. Hope you're all feeling groovy like me. We are having a ball today. Our seniors are driving up curbside, picking up goodie bags that we have chocked full with information about our department's virtual activities. We also have literature from our current sponsors for 55 and better programs. We have snacks, bingo cards, and lots of other goodies included.
I always have fun when I come here. I was in the stained glass class, and I was in the class of, what was that, Medicare class, Medicare. They have lots of interesting classes for seniors.
You got all your loot? All right. We're glad to have you. Bye.
I'm not sure what all's in the goodie bag. There's lots of things in there.
You think you might end up trying a little stained glass? Maybe not? Okay, but it was interesting to watch.
I'm glad I watched it to learn exactly what's all involved.
I'm going to give you one of these, and I'm going to give you a lovely mask homemade by one of our seniors. Our seniors are participating in our virtual activities by giving us their email address. We take that to our master list, of which we have close to 700 emails now. And we will continually be sending you email invitations to log into Zoom. If you haven't figured out what that is yet, we can help you. You can play bingo twice a week, Mondays and Fridays at 11 a.m. And we distribute the prizes once a month here at Rokeby Center. And on Wednesdays, We also conduct virtual presentations on a variety of topics. It might be Medicare updates. It might be a little chair exercise with our staff member, Melody Beck. So the seniors are logging into those, and every Friday, they're picking up a goodie bag just for participating.
Play bingo. Love playing bingo.
Yeah, what do you like about it?
Winning. They have very good programs. They try to keep a variety of things. Having fun.
Awesome.
In my old age, having fun.
Hey, Brady. We've got...
Are you having fun?
Yeah.
Yeah, we're having a lot of fun. This
Chesapeake
lady's crazy here, I tell you. And she never slows down. And she's got her people the same way almost. It's contagious.
Is that right, Ken?
You got it from the horse's mouth.
Today I did win bingo, yeah. Oh yeah, we have fun. We always have fun.
We have a winner!
Yay!
Thank you.
That is a very cool map.
Wonderful. This really is. I'm having an amazing time. And these people take care of us wonderfully. My chin is up. You may not be able to see it, but my chin is up.
I can see it in your eyes.
All right, bye!
Having fun!
She says those kind things to me, but she's really the one that's added so much to the surroundings here. And even just getting that type of feedback, you know, that's what fuels our internal motivation. And so people wonder, you're so excited all the time. And what they're really seeing is just our true passion for the subject of bringing quality activities to our citizens. It just fills us with pure joy.
So again, Zoom bingo, twice a week, prizes given out monthly at the Rokeby Center. It's so much fun to be had. If you want to get in on the fun, there's definitely room for you. Visit cityofchesapeake.net/55 and better, or just call the Parks, Recreation, and Tourism Department at 382-6411 to learn how to get involved. If there's an emergency in our city, whether it be hurricane, flood, something else entirely, will we be able to reach you? Well, we certainly hope so, but we need you to be signed up for Chesapeake Alert. Through this alert system, you can create your own profile and choose how and when we get in touch with you. You can also opt in to several helpful alerts, such as travel advisories and Parks, Rec, and Tourism information. Check it out and sign up online today at cityofchesapeake.net/Chesapeake Alert. Unfortunately, I hate to be the one to deliver this news because I know how much everybody loves these events, but we've had to cancel the last Chesapeake Recycles Day. It was scheduled for November 14th at Tidewater Community College, but due to COVID-19 restrictions, we've just had to cancel this last one. We'll try again for all of them next year. In the meantime, if you have items you need to drop off, you can bring electronics for recycling to any Goodwill store, and you can bring household hazardous waste to the SIPSA transfer station in Greenbrier on the first Wednesday and third Saturday of each month at from 9 a.m. to 12 p.m. So those are a couple of options for year-round recycling and proper disposal. Learn more at cityofchesapeake.net/recyclesday. Veterans Day is this week, and with that comes some city schedule changes. All city offices, courts, libraries, and community centers will be closed on Wednesday, November 11th. There will be no changes to the trash or recycling collection schedules. And we've got another meeting update for this week. The Planning Commission meeting that normally takes place on the second Wednesday, that would be Veterans Day, has been moved. It'll actually be taking place this week on Thursday, November 12th at 6 p.m. at City Council Chambers and City Hall. You can find the agenda and more information about the commission at cityofchesapeake.net/planning. Well, as we all continue to find new ways and safe ways to meet while COVID-19 is still such a concern, we here at the city are looking for ways to make sure that we can hear everybody's voices, to make sure that your questions and concerns about city services are being answered and addressed. So you know that we normally have 4 town meetings every year, and those are of course in person, often large group meetings. One is scheduled for December. So instead of hosting that in-person meeting, we're trying something new. We're going virtual. So starting next week, November 16th to the 22nd, we'll post a link to an online survey on cityofchesapeake.net and facebook.com/cityofchesapeake. On this survey, you'll be able to ask us anything you'd normally ask at a town meeting. We'll put all of those questions together, get them to the people who can answer them, and we'll provide a video, or in some cases written, responses the week of December 7th. So starting next Monday, be sure to find that survey link on our webpage or our Facebook page and tell us any of your questions or concerns. And finally, we're ending on a great note, another example of just how real the city that cares is. So a great example of caring here in Chesapeake, a Chesapeake police officer caught wind of a 97-year-old Chesapeake resident who is currently in the hospital and was in desperate need of a handicap ramp for his house so that he could come home. This is something that could in past years maybe have been completed by a Serve the City project, but that program isn't active right now due to COVID. So between this officer, a member of the Chesapeake Department of Human Services, and several community members, they were able to get this ramp built for this deserving resident. Thank you so much to all of those who were involved in this, community members, city employees, our police officers. Thank you for continuing to show us that we really are the city that cares. That's all I've got for this week. Thank you so much for tuning in. Everybody stay safe, stay healthy, and we will be right back here again next week.